So going into the basics of Medicare here. Some of the things that we're going to be covering in today's webinar. Enrollment periods, some of what the late enrollment penalties are and how to avoid them. Physician and provider networks, prescription drug formularies, and how the changes that are coming to the prescription drug in Medicare next year that I think has got a lot of people's attention. And then we're also going to touch upon Medicare Advantage plans and Medicare supplemental plans, what the differences are, and how one or the other might work in your best interest. So as it starts with everyone, we go into the enrollment processes. For most people here, you're going to enter your initial enrollment period. For most people, this is going to be when you first turn 65. They give you a 7-month window. Those 7 months include your birth month in the middle, the 3 months prior, and 3 months after. This is the period that Medicare gives you to first sign up for Medicare if you're going to be starting up. And this usually revolves around signing up for Part B, which we'll get into shortly. But this is where your initial enrollment period is. But no matter when you sign up for everything, the earliest you can start Medicare would be that first of your month or your birth month there. The only difference is if you were born on the first of a month, everything gets pushed a month earlier. So if you're born on February 1st, your Medicare could actually start in January, and those 3 months prior will actually push forward as well. Would be one of the exceptions out there. And then we're going to start talking about those different enrollment periods that everyone needs to be aware of when you first get into Medicare. At the top there, you see the initial enrollment period, where we just covered there for most people. That is going to be when you turn 65. Exceptions there would be someone who is collecting on Social Security disability. You will be automatically enrolled into Medicare on the 25th month of your disability. Next, we have the annual enrollment period. October 15th to December 7th every year. Just like when you're on group insurance or commercial insurance, you have to renew your insurance every year. This is when everyone on Medicare gets to review the options that are coming out for the following year. Nice thing about it is if you like your insurance, you're happy with what you have, you actually don't have to do anything like you do now, where you have to re-up with everyone and tell them what changes you want to make. You just stay where you are. They automatically enroll you. But you do get to review all those other options. And this is the time of year that you can make changes if you want to move between different Medicare Advantage plans. You want to change your prescription drug plans. You want to drop down to original Medicare or add different coverages. This is the time for everyone on Medicare to make those changes if they need to. Next, there is the Medicare open enrollment period, or I'm sorry, the Medicare Advantage open enrollment period is what it's known as, or just the open enrollment period. A little less known enrollment period out there. It is specifically there for people that are already on an existing Medicare Advantage plan. It's essentially in place, and it allows you to make a one-time change between January 1st and March 31st. It was put in there to help guard people against changes in their networks. A lot of times these insurance carriers and hospital networks or doctors, there'll be negotiations and it'll go down to the wire at the end of the year. And if you look at the annual enrollment period, you need to make a decision on your plan by December 7th. This gives you the assurance there that if there is a change at the end of the year to your coverage and your network, that you can get into a plan that would assure that you still have continued coverage throughout the following year. But once again, you do need to be on an existing Medicare Advantage plan in order to access that enrollment period. Finally, we touch into the special enrollment periods. The ones you see listed here are the ones that are always in effect. SNPs are special needs plans. Some of those that are around are if you are Medicare and Medicaid eligible at the same time. You have an extra enrollment period. Extra Help is a program from the federal government. It's also known as low income subsidy. It will help pay for prescription drug coverage. State Pharmaceutical Assistance Program here in New York State that is known as EPIC. It helps cap the cost of prescription drugs for people that are enrolled in a Medicare prescription drug plan. But it does allow you to make an extra plan change every year if you needed to. Loss of employer coverage. So this is either by your own or not by your own, whatever it is. This is one you can use when you decide to retire. as a reason to make a plan change. If you're on an employer plan and you're looking to go into Medicare, this opens up that window to you to make a change at any time throughout the year. And switching to a 5-star plan. So what that means is there are ratings for all the Medicare Advantage plans out there, and prescription drug plans. And they are rated by Centers of Medicare and Medicaid, known as CMS. They rate these plans. There is a lot that goes into these ratings. They talk to people that are enrolled in them. They audit the carriers for financial stability. They also go through and they talk to providers, doctors, hospitals to talk to them about the plans and how they're performing. So there is a lot of knowledge that goes into those. But you are always allowed to switch to a 5-star plan at any time throughout the year if you are not enrolled in one as well. On top of that, sometimes there are other special enrollment periods that do come around. These would be issued as states of emergency, either from the state or possibly the federal government through FEMA. And a lot of times those will open up a special enrollment period to people in either the entire state or into select counties that would allow them to make plan changes to help accommodate the fact that their situations may have been affected by those events. There was one recently enacted here a month or two ago because of the tornadoes that went through. So once again, things like that, we can't really depend on them being there, but sometimes they pop up for individuals to help make those changes if necessary as well. And I'm sorry, I actually had a pointer to go through all these different ones, and I didn't realize my boss had updated that for me. So apologies to everyone there for that one. So now we're going to get into the Medicare overview. So talking about the different parts of Medicare that we have here. So first off, we have right here is Medicare Part A. This is your hospitalization insurance. This is what most people have been putting into their entire life. When you see that little Medicare deduction in your paychecks, this is what it's going to. This will come to most individuals at no cost. As long as you have worked and paid taxes for a total of 10 years or have had someone that has done that on your behalf. And what it provides is inpatient hospitalization care, skilled nursing facility care, hospice care. There's some home health care in there as well. And once again, that'll come into you for no additional charge as long as you've worked and paid those taxes. So most individuals are going to pick that up when they first become eligible, because if it doesn't cost you anything to have it, it's actually a little extra insurance on top of whatever other coverage. There are some exceptions to that, and that would revolve around HRAs and such like that. But it's a good reason why you'd want to talk to someone ahead of time just to kind of set up to make sure you're not going to face any back penalties or anything like that if you're in one of those situations. Next, we have Medicare Part B, medical insurance. I always tell everyone, think about your doctors. This is the part of Medicare that allows you to see your doctors. Your primary care physician, most specialists are included in here. What is the specialists that are not included on this Part B of a Medicare would be dentists, routine dental work, routine hearing, routine vision. But all your other doctor's visits are going to be in here. Your outpatient care and services. So this is where surgeries are covered as well. Medical supplies. So for diabetics, it's included in here. Your medical supplies, any kind of mobility devices, preventative services as well. So this is your routine annual checkup with your doctor, your colonoscopies, all those other routine services are going to be provided by this Part B insurance as well. This is the part that they want you to first sign up for when you become eligible. So when we go back to that original enrollment period that we talked about, this is what they're talking about getting enrolled in initially. Part B, it does come with a premium. Currently, that standard premium is $174 a month. It will probably be going up for next year. We do not have an exact amount yet. We are waiting for it. It could come out any day. Just nothing has been officially given to us yet. And that amount is based upon income as well. That standard is based upon currently for this year of 2024. If your income for an individual is at or below $103,000, or for a couple $206,000, you will pay that $174 a month. If you are over those thresholds, they do issue you what they call an income-related monthly adjusted amount, known as an IRMA. And what that means is you're going to pay a higher premium for the insurance. It does reset every year. They do look back 2 years at your income. So if you're looking going into retirement, obviously most people, your income is going to drop. So hopefully over time that will drop down. There's also a form that you could always submit as well to help get that along the way a little bit quicker. If your income has drastically changed between your retirement and what your income was 2 years ago. I do like to skip over Part C real quick and go into Part D at this point. This is your prescription drug coverage, because this is the other part that they want you to sign up for when you first become eligible. It is what allows you to pick up all your prescriptions from a pharmacy, essentially. Anything that you receive from your doctor in your office in their office will be covered under Part B insurance. So Part D is your pharmacy, essentially. They do want you to pick this up when you first become eligible. You do pick up these plans through private insurance carriers, and they sell different options. They do come with an additional premium as well. Both Part B and Part D are the ones that they want you to sign up for when you first become eligible. And if you do not sign up for them when you first become eligible in the initial enrollment period, and you do not have creditable coverage, which we'll touch upon in shortly, that is when you start facing those late enrollment penalties that you hear people talking about. For Part B, those late enrollment penalties are 10% of the premium for every full 12 months you have gone without coverage. And it does follow you for life. It does not reset. So those penalties continue to just that 10%, 20%, whatever they might be issuing you, it just keeps going on. And as the premium goes up, that percentage just stays in there. For Part D, they do charge you 1% of the national average of the cost of a prescription drug plan for every month that you went without coverage. So that's a tougher one to kind of calculate there, because what the national average is, only way you really ever can get that is by actually talking to Social Security and asking them what that penalty would be. But once again, those are the ones that they want you to sign up for when you first become eligible if you do not have creditable coverage. When you talk about Part A and Part B together, that is what they mean when they talk about original Medicare. So if you ever hear people talk about original Medicare, signing up and being on just original Medicare, that's what it is. They have just Part A and Part B, and then you always want to add on Part D to make sure you have that prescription drug coverage. The other part that is out here, obviously, is the Part C. These are the Medicare Advantage plans. These are the ones from the private insurance companies. If you are anywhere near the age of 65 or over 65, these are the people who are absolutely loading up your inboxes and your mailboxes, getting a hold of you, telling you need to sign up with them now. And what they are is they are insurance plans from private insurance companies that take over running your Medicare for you from the federal government. You're allowed to enroll into these as long as you are enrolled in Part A and Part B. You are allowed to enroll in a Medicare Advantage plan with a private insurance company, and it kind of becomes your all-in-one at that point. They take over covering all your Part A and Part B services. For most people, they're going to include your Part D in there as well. So it's a convenience thing of not having to sign up for multiple parts at that point. And they're going to give you the extra benefits that you're not finding on original Medicare, like dental, vision, and hearing. So they have become much more popular in the last decade or so, because of the extra benefits that are included in there, everything else that's included in there with it. You get your gym memberships in here, all those other good things, positives and negatives to being in them, which we will go into shortly as well. And I'm going to apologize. I do not actually see the chat, so I will at the end of everything is when I'll address any questions that might be coming through.
We have no questions at this point.
Oh, okay. No problem. So I will kind of move into the next section here, just a little bit more on Part B, because it does tend to be that one that has more of a questions, because like we said, this is the one that they want you to sign up for when you first become eligible. Once again, covers your doctors, covers your outpatient care, medical supplies, services. A lot of everything else is in here that they want to talk about. What makes you have to sign up for this when you first become eligible and criteria? Are you going to continue working past 65? And do you need to sign up for Part B? The big questions are, is your employer a credible coverage? So essentially what that means is, do they have 20 or more employees working for them? If they do have 20 or more employees working for them, is the policy holder actively working? That is the key question. I do talk to people who are allowed to continue their employer coverage after they retire early, and they can keep it until they turn 65, and then they're required to sign up for Medicare. And they have a spouse on that coverage, but the spouse is a little older than them, a year or two older. That spouse is going to need to sign up for Medicare when they turn 65 if their spouse is not actively working. So you just want to be careful of that. If you do not do that, you open yourself up to those late enrollment penalties. The other part that you always want to check in on is this is for the Part B coverage. Part D is a little bit separate. They want you to have credible coverage for Part D. What that means is your employer has to offer coverage that is at least as good as Medicare's coverage for prescription drugs. This is something that your company is required to post yearly. Most people don't notice it because if you're not looking into Medicare or not involved in it, you're not going to notice when they put up a little flyer about Part D coverage. But it is actually a simple question. You can send an email, quick call to whoever's in charge of your benefits at your work, usually through HR. Just ask them, hey, are we credible for Medicare? And they'll be able to tell you yes or no. They should know off the back of their head. But that is the other one you always want to make sure of. If you are under those 20 employees, no matter what the situation is, with your boss willing to pay whatever they want for your insurance, you still need to pick up that Part B. If you do not, they will hit you with a late enrollment penalty when you go to enroll later on. Once you are working past 65, and when you are retiring, you and your spouse are granted that special enrollment period that I mentioned earlier. Essentially, when you're working, you're given an open window and you have that credible coverage. You have an open window to enroll into Medicare whenever you see fit. So for most people, that's going to be when your coverage ends because you're retiring. Sometimes it does happen though, where people's coverage changes so much on there that is no longer financially makes sense for them to stay on their employer coverage, and Medicare becomes a better option for them. So that does happen as well. So it doesn't really matter either way. If you're ending your coverage because you just want to end it, or if you're retiring, you can enter Medicare at any point in time that it would benefit you at that time. Once again, your spouse should enroll in Part B when eligible. That is as soon as the person with the policy becomes not actively working, the spouse needs to enroll in Part B if they are of age. And once again, at the bottom, it just talks about evaluating your employer plan to Medicare plans. Some people don't realize that you can save money even though you're working versus your employer plan. There's a lot of high deductible plans out there on the market now. These Medicare plans do not have those high deductibles. So for a lot of people, you can save money by enrolling into a Medicare plan at the beginning and dropping your employer coverage and having Medicare while you're working. Kind of a little graph here of the different ways to have your Medicare and get your coverage. When you're looking at the top here, you have original Medicare. So once again, that's just having Part A and Part B. When you have Part A and Part B, you can sign up for what they call Medigap or Medicare Supplement Plan. So these are separate from Advantage plans. I know some people kind of tend to at times interuse the words supplemental plan and mean a gap plan or mean an Advantage plan. But a supplemental or Medigap plan is different than an Advantage plan. They are regulated from the federal government. These are plans that have letter numbers. So if you ever hear anyone say they have their F plan or G plan or something like that, they're referring to Medigap. And what they do is they work in conjunction with original Medicare and fill in the so-called gaps. So what that means is there is leftover cost on Medicare. When you talk about Part B coverage, you have a $240 deductible at the beginning of the year for original Medicare with Part B. After you meet that deductible, Medicare will pick up 80% of the cost, leaving you with a 20% coinsurance. What a gap plan does is it'll pick up that coinsurance for you, so you have no out-of-pocket costs when you're using your insurance, seeing doctors, anything that is covered under original Medicare, it'll pick up for you. There are additional premiums, obviously, to pick up these types of coverages, and they do tend to fluctuate. There's ones that are under $100. There's the ones that go up to a few $100s. Really depends on the amount that you're looking to have picked up by your plan at that point. The one thing they don't do is they do not include that Part D for you. So you need to pick up that additional Medicare prescription drug plan to go in conjunction with your supplemental plan to receive your prescription drug coverage at that point. On the other side there is the Advantage plan. In both cases, you do need to stay enrolled in Original Medicare in Parts A and Parts B to receive coverage. And then in the Advantage plan, you would just sign up for that, and it would include the Part D coverage with you. So essentially, those are the two ways that people kind of supplement or get better coverage than what is offered off of Original Medicare. So once again, two paths to choose here when you're looking at coverage. Original Medicare versus Medicare Advantage plan. And this is really what a lot of people, when they first get in, which one is best, which one is best, what should I do? If you kind of look at it, on the first side here, you sign up for Original Medicare, you have a Part A and Part B insurance, and you sign up for a separate Part D plan to get your prescription drug plans. Supplemental insurance if you want to buy it, so it's a Medigap plan. Once again, that'll fill in the coverage gaps on Part A and Part B and pick up either the co-insurance and deductibles out there. Currently for Part A, the leftover cost, your first 60 days of in-hospitalization care is $1,632. After that, you will pay nothing else for for your first 60 days. The supplemental plans will pay that $1,600 for you. And then they'll also pay the leftover cost, which is day 61 to day 90. It is $408 per day. After day 90, day 91 and up, you enter your lifetime reserve days. And that is exactly what they are. You get 60 of those for your lifetime. If you use 2 in 1 year, you're down to 58 for the rest of your life. And those go up to $816 per day. Once you use those up, you are 100% out of pocket. It does reset every year though. So the day 1 to 60 will reset every year. But those supplemental plans will pick up those costs for you, along with your Part B co-insurances. The only thing that they do not pick up these days for anyone who's becoming new to Medicare is the $240 deductible to start the year. The plans that used to do that are being phased out, and anyone new to Medicare is no longer eligible for those. On the other side here, the other path obviously is to go with the Medicare Advantage plan, where it combines your coverages for Part A and Part B, gives you your prescription drug coverage. It also adds in those extra benefits that I had mentioned before. The biggest difference here for most people is going to be cost. Going Route 1 tends to cost several hundred, or at least a few $100s more than going in Route 2. Route 2 usually saves people money on top of giving you the extra benefits as well. That being said, it doesn't always make the right choice there, depending on your individual needs, your travel needs. I believe my next couple slides here are going to go into that a little bit more here. Why would you choose a supplemental plan? Well, the first reason there is no networks. So you're not these carriers, when you sign up with a carrier, you have to go to some place that accepts your insurance, obviously. With supplemental plans, that's not the case. As long as the doctors and the facilities, which most are required to accept Medicare from the federal government, you can take it anywhere. And the supplemental plan just works in conjunction with Original Medicare. So anywhere across the United States that you want to go, you can go in network. People who want to go and receive treatment at many different facilities, not just locally here in New York. Maybe you want to go to Cleveland Clinic and Mayo Clinic or see a specialist somewhere down in Florida. It does make it very easy to transport and go to different places throughout the country. You're not worried about those network coverages or shifts in coverage. Provider must accept Medicare. Once again, here in New York State, we have a couple of things that make these very accessible as well. We have guaranteed issuance and renewability, which means no one can ever be denied or kicked out of a plan at any time. The only reason you could ever be disenrolled from a plan without you wanting to do it yourself is if you fail to pay a premium. This also means that anyone who is signing up, no matter what age you are or what time you sign up, you will pay the same premium. The premium is guided by where you live, so everything is county rated. So the county that you live in is going to determine how much you pay for these policies. So whether you're a 100% healthy person who never sees a doctor or sees a doctor once a year and is just turning 65, or you're someone who is 90 years old and been diagnosed with dialysis and cancer, you're both going to pay the same price. Some other states are not the same way. You will pay a different price later on in life than you will if you don't sign up when you first turn 65 or first become eligible. They're very comprehensive plans. Once again, this is going to limit or eliminate all your out-of-pocket costs for services. People who are receiving chemotherapy, dialysis, different things like this, like go into these plans because they know they pay that higher monthly premium, but they know they have no leftover costs. They will go and have treatment done, and they will pay nothing when they're going in and out of treatment, seeing doctors, anything like that. The other thing that they are here in New York State, which makes us very unique, it's only us in Connecticut that offer this. We have what is called continuous open enrollment of Medicare supplemental plans here in New York State. What that means is all those enrollment periods that I mentioned before, kind of out the door when it comes to supplemental plans, except for initial, because obviously you have to be on Medicare to enroll into them. But after that, if you ever need to enroll into a supplemental plan because your health changes or whatever the reason might be, you can enroll into a supplemental plan at any time throughout the year. The only hookup to that is the prescription drug plan that you would want to add on to that as additional coverage to receive your prescriptions. Those do need enrollment periods to get into. That is when we would try and help you find those special enrollment periods I had mentioned before, those FEMA emergencies, those state of emergencies that New York State may have declared. You can use those to help you get into those prescription drug plans at that time if that was something you would need to do. Why consider a Medicare Advantage plan? Besides the very first reason that I mentioned before, you're going to have a lower cost when you look into these plans. They are required to cover everything that is on original Medicare. So you're not losing any coverage when you go into the year. They also have those nice set low co-insurances and co-payments that we have been used to. So you have scheduled payments there as compared to original Medicare, where you're paying 20%. You know exactly what you're going to pay when you see your doctors. It's written in the contract with your evidence of coverage from your insurance carrier. So you know exactly what your payments are. Once again, same benefits as original Medicare, required to cover everything that's on there. And they're going to give you those additional benefits. This is one of the bigger reasons why people are looking into these, not just to saving a cost, but you get your dental insurance in there. You're getting your vision and eyewear covered. You're getting hearing care as well. Hearing aid coverage is included in these plans. So they are very popular for people because of these reasons. Your prescription drug coverage is going to be included in there, so you don't have to add on that additional coverage. So once again, that's another cost savings for people. One of the shocking things for a lot of people when they're comparing these as well, you would think a prescription drug plan that you're paying an additional premium for would give you better coverage than something that is included at no additional cost in these plans. And it's actually not the case. These tend to have better prescription drug coverage than your standalone plans. And the biggest reason for that is you are actually paying for these plans. By paying your Part B premium, that money, once you enroll into these plans, the government actually gives a portion of that to the insurance carriers. So that's why you're going to get coverage in here for them for no additional cost for a lot of people a lot of the times. So the best way I've always told those people is you're paying for it. You're just paying for it in a roundabout way. You pay Social Security comes back and pays these insurance carriers. That's why you can find these plans for no additional cost. Some of them will even give you money back. They call them give back plans. Joe Namath, I was talking about these on TV a few years ago, if you remember. They'll put money back in your Social Security, and it is what they do. They'll put that money back in your Social Security, help lower that Part B premium that you're paying. What happens there, though, is nothing comes at no cost. They're going to remove some benefits or lower benefits for you, or you're going to pay a little bit extra to go and see your doctors. Those plans are geared towards people who are healthy and don't use their insurance very much. But they are very good benefits and they become very, very popular. People who are turning 65 now are just in better shape, take better care of themselves, better health insurance that we've had our whole life has just led to people being healthier and they really enjoy those give back plans that are out there. Couple of differences between Medicare Advantage plans. People always say, well, Medicare Advantage, I can't go anywhere. You're not going to get coverage anywhere else. So it really depends on the style of plan you have. And like I said, these really operate like the insurances that we've become used to having most of our working lives here. The two main differences here is you have an HMO or a health maintenance organization or a PPO or preferred provider organization. And every insurance carrier that I'm aware of offers both. So it really is going to become a needs analysis for you at that time. Both of these types of plans have networks, and you're always going to want to stay within your network. With an HMO, you're only going to receive care within that network. If obviously, if an insurance carrier, if a doctor or organization does not accept your insurance, one of two things is going to happen. They're either going to turn you away because they're under no obligation to see you if they don't accept your insurance. Unless it is an emergency or urgent care situation, you're always covered worldwide emergency urgent care, no matter what type of plan you have. But they're not required to see you otherwise if they do not accept your insurance. Or if they do see you, you're going to pay 100% of the cost out of pocket because your insurance carrier is not going to help you with anything they're not under contract or obligated to do. You also may need to have a referral to see a specialist in an HMO plan. They are starting to get away from those, and it's really about a 50-50 on those if you still need referrals these days with those HMO plans. With the PPO plan, you still have a network, and you want to stay within the network because you're going to have those nice low set co-pays for services and everything like that. But you can go outside of that network and see any doctor that will see you around the country. I do say will see you because one of the things that people get confused in is they say they have a PPO so they can see anyone they want. But once again, if they're not contracted with your insurance company, they are not obligated to see you. So I always want to make sure everyone realizes that. That being said, you can go to them if they're willing to see you, and you will still have a copay or a co-insurance. It can be higher than your in-network pricing though. They also might require you to pay that up front, at which point you would have to file for a reimbursement from your insurance company to get their portion of the payment back as well. So it always does behoove you to try and stay in network. The other nice thing about the PPO plans, though, is there's no referrals. People like them because of that. You can go and choose any doctor you want to see, and as long as they'll accept you, you can go and see them without a referral from your primary care. They also transport across the country. So this is kind of the answer to This is kind of the Medicare Advantage answer to the portability of supplemental plans. Yeah, if you enroll with a carrier, I'll just mention here in Western New York, you have a carrier like Highmark. They are Blue Cross Blue Shield. Any place across the country that accepts Blue Cross Blue Shield, you are in network with their PPOs. So you can see any doctor, any facility across the country, and it'll be the your in-network cost. You don't have to worry about that out in network if they will or if they won't, or if you're going to have a higher cost. So that becomes very popular, especially for snowbirds that are going to spend part of the year up here, part of the year down in the south. They want to have doctors involved. There's someone who's going away for a few months that may have had a surgery and needs to do rehab while they're out of town. You can still get coverage for your physical therapy when you're out of town as well. That being said, both of them always emergency and urgent care. Always make sure everyone knows that you're never going to be turned away in an emergency situation. I know I have people all the time who tell me things like that. They read articles. It does not happen. You do not get turned away in an emergency situation. You'll always have coverage anywhere you go, no matter what plan you have. So now we're going to start talking about a little bit into the prescription drug coverage. And this is where you're seeing most of these changes and why these carriers are making some pretty big changes for them, their plans and everything next year. Talking here about what to consider, what kind of monthly premium can you afford? And I always tell people, is it worth that monthly premium as well? What are the advantages of it? Because sometimes you think that you're going to pay an additional premium, you have a better plan or better coverage. It's not always necessarily the case. It really is about your utilization, if it's worth having a premium. You're a person who utilizes your plan and utilizes services more. That's where that additional premium is going to come into more effect for you. With your prescriptions, it could be maybe it'll help knock down those copays and everything for you. So this is where you really got to do that needs analysis for everything there. How often are you using a plan? What prescriptions are you taking? Which companies are going to cover them the best for you? And of course, seeing a doctor. one of my most primary ones is any plan you go into, you always want to make sure your doctors accept, because insurance isn't good if you can't use the doctors that you want to go use as well. Prescription drug plans, always making sure existing medications are covered. Every carrier is not required, and every insurance plan is not required to cover every medication that is out there. They're required to cover 2 types in each therapeutic category, and they can also tier them off differently than everyone else. So that's where you really want to look through each insurance plan that's out there to make sure your coverage is being, your prescriptions are being covered in the best way possible for you. So that's why we talk about prescription drug coverage. There are 5 tiers. So these 5 tiers exist on all plans on Medicare. Whether you get it through a standalone prescription Part D plan, or if you get it on your Part C with Medicare Advantage, they're going to have these same 5 tiers. Tier 1s are always preferred generics. Tier 2s are generics. Tier 3 are your brand names. Tier 4 are non-preferred drugs, and Tier 5 are specialty tier drugs. And as you can see, they get more expensive as they go down these tiers. It is over 70% of medications now are made up on these generic ones. These are all your maintenance things that most people take, or your blood pressure medication, cholesterol pills, all these different things are included in here. What makes the difference between a preferred generic and a generic essentially is just pricing for the insurance carrier and the companies that they're working with, and possibly even which pharmacy you're using. It's always something that does actually come into effect, believe it or not. Brand names, that's going to be anything you know the name of. If you have a jingle stuck in your head because of a drug, it is a tier 3. We say if it's on TV, it's a T3, so it's a tier 3. It's a brand name. It's going to have more of a cost to it. Non-preferred medications are just that. There's something else that they cover that they prefer you to be on because it's either cheaper or more readily available. So if you're taking something that there's an alternative of that they'd rather have, but you want to take that, or your doctor wants it, you're going to pay a higher cost, or at least a higher percentage of the cost of that drug. Specialty tier, once you get into here, these are pretty rare medications. Cancer pills, different things like this fall into there. Pills, anything that's in this category, I believe it has to be $930 or more per prescription to qualify to be on the specialty tier. But once again, you will pay a higher percentage. They're more costly and everything in there. But once again, no matter where you get your prescription drug coverage on Medicare, it's going to have the same tiering plan to plan. It's just a matter of where these companies place your medications as to where the cost for you is going to come into effect. So the big thing that's going on right now, everyone is talking about, is the Inflation Reduction Act and how it's affecting everything on Medicare. The first big thing that came through is actually listed down here, the insulin cap that came in a couple of years ago in 2023, capped the cost of insulin for anyone on Medicare at $35 per month. So you can never pay anything more than $35 for your insulin for a month's supply of your insulin. Some carriers do a little bit less. It depends on which insulin you're taking and how you're going to get it. But that went into effect 2 years ago. Annual out-of-pocket this is the big one this year that is happening, that everyone that's causing if you're talking to anyone that is on Medicare and they talk about changes, or maybe you know someone that's on Medicare and they've told you, hey, my plan disappeared. Some of these carriers are doing that. This is causing a very big change for them. This is causing the coverage gap, or that donut hole that had been out here. Maybe some people you have heard about, to go away. It was kind of a pain. It really was, because it just caused your cost of your medications to go up and down. You'd start the year with your deductibles and co-pays, and you go, it'll go up and then it'll go down, and then all of a sudden you'd hit the coverage gap and your costs would go back up again to even more expensive than you were paying at the beginning of the year. Then all of a sudden you'd hit it, and then all of a sudden you'd have no bill, and you're like, what's happening? Why am I not getting a bill? And it's because you're going in and out of this coverage gap in the donut hole. Simplifying it very much for next year. Super easy. You're going to start the year and you're going to pay any kind of deductible you may have in your plan. You're going to pay any co-pays that are for your medications, and you are going to be capped at $2,000. So once your cost of medications hits $2,000 for the year, their plan is required to pick up the rest of your medication costs for the remainder of the year. So there is a lot of cost being left over there for the insurance carriers to pick up, is why they're making so many drastic changes. Western New York, wasn't impacted too bad. Rochester was hit really bad. Central New York was kind of steady as well. If everyone and wherever you are, just kind of give you a little lay down of how it happened there. Um, but each carrier is kind of reacting to this a little bit differently too. Some of them are trying to maintain their benefits in their plan a little bit more without making too many drastic changes. But what they're doing is they're making people pay more of that percentage of that cost on their medications, though. Then there's other ones that are making more changes to their benefits on their plans, but they're having better laid out ways for people to get their medications and holding a little bit more firmer to the old copay systems that were out there. So you can find, especially when you get into name brand medication, they're helping cover those name brand medications next year a little bit better for people. But you might be rolling back some of your other benefits within your plan to get those. So we're telling everyone more so than in the past, you really, really want to review your plans this year. Because just the changes could be your carrier, you could be paying, a couple $100 next year, and then all of a sudden you're going to pay $1,500-$1,600 for your medications. So you really just want to look at it to make sure that the plan that you have is going to cover your medications for you in the best way they can. Once again, vaccines, they're always going to be covered. Anything that's a recommended vaccine, so your flu, your COVID, your shingles, anything like that your doctor is always, when you go in, they're always telling you to get, it's covered for you at no cost. Nothing in there. Inflation reduction rebates. So this goes into up here at the top, the negotiation. They are starting, these are those 10 medications that they started off with. They said, we need to find the better pricing for these medications. That'll be going into effect in 2026. They've been working on that. We do not have the information on that yet, obviously, until they happen. How those negotiated rates are going to affect the plans and the cost for people. I'll talk to you next October about that when we have that information. We probably will not have any of that and be before that, to be honest with you. And then Part D changes there. No payments for catastrophic coverage. Once again, that was a change that happened last year, and the catastrophic coverage was after you went in and out of the donut hole. This year, it's when you hit that $2,000. They're just forcing these companies to pick up the remainder of the cost for you for the year. Next steps here. So this is just, like I said, for AAA, what we do here for you, we bring you in, we listen to you, what you and your needs are. We do the Medicare math for you. It's our way of saying that, we compare those costs for you. We help lay out what it is. We take into what matters most to you, in which direction you want to go. Some people, they're not worried about it. They want to pay the high premium, not want to pay the high premium, but they want to know they have that insurance, especially with supplemental plans. They're not worried about the cost. They just want to know they have what they have and those no out-of-pocket costs. Lay out those differences for you. Make sure you know what it is. Once again, we do an unbiased review for you. We work with these carriers, but we have no bias towards any of them. We are in conjunction with them all the same. Anything that would come back to us from them is straight across the board. So we don't lean towards anyone. We are putting you in your interest is the most important thing that we do. And we enroll you too as well. We make it easy. We're your one stop. We'll put you into these plans, and then we work with you throughout the year. We become your agent or broker of record with that carrier. So any issues or anything that come through there, we're able to speak on your behalf and help you get through anything throughout the year as well. We're an advocate on your behalf, essentially, with those insurance carriers to make sure you're getting your needs fulfilled. And then once again, how do you get a hold of us here? This is our lovely, lovely team over here at AAA. Me, I am on the right. That is our call center operator there, Christina. Next to me, next to her is my boss, Alyssa McGovern, and another one of our agents over there that is my good friend, Sam. And we all do work here year-round. We help you get in and just plan for everything as well. You can get a hold of us there. That's our phone number there, the 877-477-7120. Or you can go to AAA.com/Medicare. Or if you like to scan QR codes, that is a QR code. It will take you right to that website as well. There's some additional information there, the basic information, a lot of what I went through, maybe a little bit more detail if you're looking for it as well. That'll take you right there, and you can kind of look through that if you're looking to read a little bit more about what we are, what we offer, or just those details in Medicare as well. Outside of that is the end of my slideshow presentation there. I will open it up to questions. I don't know if I can shut this down. and
It's
see if
okay.
there
I
is
don't,
anything,
yep, there's
anything.
nothing in the chat, but thank you, David, for there's a lot of information to digest. And I know we have and it's applicable to many of the people what work here, work with Note and a lot of our clients and friends. So please, if anybody has a question, feel free to unmute yourself or you can type it in the chat box. A few minutes.
Yeah, absolutely. And even if it's nothing today, like I said, we are working with Note. So your advisors there and everything. If you need to talk to anyone, they can always help set up an appointment with us for you as well.
And I
I
will
do have
say,
a question,
yep.
if I could. This is Nancy Ware. So yes, we had independent health, and we got the notice that said pretty much they were just dropping out planned. So weirdest thing was it's 6 pages on Medigap, and it didn't say we'll have alternatives come in and talk to us about it. So, I mean, if they
So
canceled our plan, like, wouldn't they have something else that they'd offer to people?
so they're very handicapped on what they can do there. We talk to them, we meet with them, another one of our carriers that we work with. We go in, we sit down with them, they tell us about all their new plan information changes and all that stuff. And they told us about those changes and they actually dropped 4 of their plans from this current year into next year. But one of them is their most popular plan. The other 3 were very low utilization plans, but they did tell us about 15,000 people were being dropped. But they are very handicapped in what they can put into there. That's Centers of Medicare and Medicaid, CMS. Any communications like that they put out to you, they have to submit to them for their approval. And CMS will not let them advertise any other plans that they have to you about next year. So it's not really so much that they did not want to let you know about those. It's more or less that they weren't allowed to. They're very, yeah, and they have to tell you about original Medicare, because if you don't do anything, that's where you end up, is with original Medicare. And they have to let you know about the supplementals, because those supplementals you can enroll into at any time. But yeah, there are options out there. They are replacing the big plan, the popular plan. They're replacing with a new plan that's close, but they can't call it the same plan because there was too many changes. Once again, it's another thing they have to submit to CMS for approval, and they made too many changes to their current plan. So CMS said you cannot call this the same plan anymore. So that's unfortunately why they had to drop everyone.
Well, they did. So
Yes,
I called and said, how
believe me,
could you do this? Like, why are you just telling me to go to Plan or whatever the gap thing is? And it's like, you don't have anything to offer. And the guy said to me, yeah, well, it wasn't a great letter. Well, what exactly am I supposed to do about that?
yeah. Yeah,
So,
like I said, unfortunately, that's how they have to word it. Like I said, Rochester really got belted by this. A couple of carriers changed all their plans, so everyone they had in Rochester got dropped from their insurance. Another carrier out there dropped their biggest plan out there. So it's but all those letters that are being sent out look the same as your letters, even though they're from different carriers. That's, like I said, it's a CMS standard that they have to put out there. I'm sorry if they haven't been more helpful to you when you've called. Obviously, I'll put the pitch out there. If you need assistance, we're here. We can help you look through that as well. It's what we do.
that's great. Thank you. Actually, I just feel better knowing that a whole bunch of other people were dropped too, just not me.
I'll make you feel even better.
Okay, well, you just don't want me anymore?
Parents are on that plan. So I'm helping my parents pick a new plan for next year too. So yeah, it's there's a lot of people out there with it. And then there's other carriers in the area that's out their plans too. A carrier like Humana is almost leaving New York State. So depending on where you are, yeah, there's a lot of people being affected, and it all revolves around that Inflation Reduction Act and all the changes they have to make for next year.
Yeah, well, thank you. This was informative.
Okay, excellent. Well, excellent. Thank you. That makes me feel good.
Hi, this is Penny, and I'm calling from Virginia, actually. So I'm not in the New York region, but I find this really interesting.
Sure.
And I'm also listening to Nancy's comment, which like blows my mind. I am still working and we're on the verge of turning 70, right? So we're under our employer's coverage. It's a large company.
Good.
But, I find, clearly I'll be turning to, whether it's AAA or whomever as well. But I'm curious, when Nancy or others, and so many sound like they were impacted, get a letter like that from a carrier, what kind of lead time do they have? Is it like, well, election has already started, and now, you got 1 week left to suddenly make that selection? And last question on my multi-question or just comment is, what does CMS stand for? I apologize, I joined a little late and
No
I
problem.
didn't know what's that acronym.
No problem. It stands for Centers of Medicare and Medicaid. And they're the regulatory agency that looks out everything in Medicare.
Oh, gotcha. Okay.
So everything's got to go through to them. Yeah. So I apologize that as far as the lead time.
Yeah.
As far as for the lead time for letting people know about those, they
Yeah.
technically have to have everything out by October 1st. So October 1st is when all the new plan information comes out. It will not come out a day before. So it comes out the 1st. So technically they have to have everything out there. It doesn't mean it's in your hand by that. So what was this weekend? It was the 6th, 5th on Saturday. My parents didn't receive their cancellation letter until Saturday.
Then election.
So it was well after the 1st of the month.
Yeah, and then election is when, or like I've
the election's in November.
Yeah.
But yeah,
well, I can see how leaning on your expertise makes a lot of sense. I mean,
thank you.
I find it confusing as hell. And when I'm looking at the presentation, which was very good, I'm kind of smiling at myself because all these couples are like, it looks like they're having fun doing this, signing up. And I'm like, this sounds like a pain in the butt, but I'm just being real clear. Anyway, okay.
Yeah.
Nancy, I may be calling you from Virginia to find out.
There you go. I'm more than one.
The only thing I can say about Virginia is I'm not licensed in Virginia, so I don't have any information on the plans. The general Medicare stuff stays though. I can talk to you about like the A, B's, and C's like we just did here and working through to your 70. I can advise you on that side of it, but as far as the plan information, I'm just not licensed.
No, don't worry. But I see that AAA is certainly a big company, and I'll put a shout out for.
We are the only AAA in the country that is doing this. So AAA is actually regionalized, believe it or not. So we're AAA of Western and Central New York.
Oh,
we are the first chapter of AAA that is working with Medicare.
No wonder. I don't think I've gotten flagged in the mail yet. It's been USAA, United, like a lot of other. Okay.
Oh yeah.
Well, I will put a shout out for Note Advisors with that because I do work with them and I love the team. So there you go.
Excellent.
We'll take it.
Okay. Well, thank you. This has been really informative. I'm scared. Okay.
Oh, thank you, Penny. You'll be okay. And like I said, general questions, feel free to reach out to me. Anything that's general, I can help answer. You just want to be any plan specific stuff I could go into.
You're sweet. All right. Thank you so much.
And two, if you are in HR and you have a lot of employees that are nearing, retirement or getting closer, 62, 63, David's happy. We can also do this presentation, on, more of a firm level, to try to capture that audience as well, because it can be confusing whether you're a smaller employer with those 20 and fewer employees, or if you're an employer with 20 or more. So we can certainly be a resource in that avenue as well.
Yeah, and that confusing part, we get that a lot. And the biggest reason for that is as you see, there's so many different ways to get it and so many different time frames. You could talk to, 3-4 different people, what they went through, and their situations might be completely different than where you're at. So it does help to talk to someone who works with it and can really help you avoid those penalties is the big thing at the beginning. Because like I say, they follow you for life.
Awesome. Any more questions out there? Okay, great. So thank you for your participation. Thanks again, David. We appreciate your time. And we will be reposting this recording. So if anybody would like to access it later, it will be available. So again, and here at Note, we're always happy to answer your questions the best we can, but also work with trusted resources like David and AAA to make sure we get you the correct answer and the correct resource. So thank you again, and thank you again, everybody, for your time.
Thank you.
Thank you.